The Federal Centers for Medicare and Medicaid Services, that's a bureau of the federal government, are reporting today that health care spending will account for 20% of the United States economy by the year 2020. And it's federal and state governments that are expected to make up half of that spending, bringing the taxpayer tab to, ready, Ellis? $2.28 trillion. What happened to the president's promise that his health care overhaul would bend the cost curve down? Here now to discuss are my freedom fighters, Fox Business anchor and my colleague Liz Claman, Ellis Henican, Newsday columnist, and somebody I love to pick on. And Lenore Hawkins, Meredith's financial advisor. Lenore, it's a pleasure. Welcome here. Liz Claman, to you first. Is Wall Street surprised at numbers like this? Does Wall Street accept numbers of this magnitude? $1 in $5 ever spent 9 years from now will go to health care.
I don't think Wall Street is surprised by that. Wall Street's more interested in who benefits and how can they get the almighty dollar in on that. And you look at a lot of health insurance stocks, some of them hitting 52-week highs over the past year or two. Look, you've got to look at this and say who benefits, who doesn't. But when you add some 23 million extra people onto the insurance rolls, then some areas are going to benefit. But if you're talking about how much it's actually going to cost, it may take years.
Does the president like numbers like this, which his own executive branch just released, that even though he promised that Obamacare would solve a great deal of our financial health care related woes, in fact, I know it's just a prediction and it's 9 years from now, $1 in $5 is going to be spent on health care because of Obamacare?
No. You were right up until the because of Obamacare part.
Does the president like this?
No, of course not. Everybody hates this. It ought to be way cheaper than this. And the frustrating thing, Judge, is that our results aren't particularly good. You stack us up statistically against lots of other nations, and we come up on the short end. So, no. The problem, however, isn't Obamacare, just to say this quickly.
Go ahead.
It's that there's so many others taking money out of the system. The insurance companies, the hospital administrators, the healthcare organizations.
Lenore, even though I love Ellis, wasn't he wrong when he wanted me to cut off the last few words of that question? Isn't this because of Obamacare that these prices are going up? What other formula are they basing this on?
It's fairly common sense. How do you determine the price of a good? Price is decided by how much it is wanted, demand, and how much is available, supply. The only way to decrease the price of something is either to increase the supply of it relative to demand or decrease the demand relative to supply. Well, Obamacare got this all backward. It increases demand and does nothing for supply, and many argue that it actually harms supply because a lot of medical care providers are going to get out of the market because it's too onerous.
All right, so the president can really have the best of all worlds. He can argue that he put a safety net for health care under everybody else, but he'll be former President Obama in 2020, and that's when the cost will kick in.
Hold on a second. With all due respect, part of the issue here with this healthcare reform that will take us so long to figure out whether it's really working is that doctors and health organizations will be rewarded for results, and they will be rewarded for prevention. Obesity is the most expensive drag on healthcare. Heart disease, diabetes, which is that chronic disease that needs chronic help. If we can avoid that, which is what this plan tries to push for, then you might see the cost curve bend.
Are you surprised that if the government's going to be paying the health care bills, the government's going to tell you how to take care of yourself? And do you want the government that can't deliver the mail to tell you how to take care of yourself?
No, inevitably someone is not going to tell us how to take care of ourselves, but someone does decide who pays. And today the insurance companies are deciding. I'm not sure that the government would be any worse. So personally, I would trade my high-priced health insurance for Medicare. Can I please have that?
You would trade your high-priced health insurance for something put together by the government?
Well, it's a lot better than what I'm buying out on the open market for $11.50.
But you have a choice in the open market, right? You could buy something cheaper or more expensive.
Hey, find me a good one if you can.
Switching gears, state governments may have the most to lose if the debt ceiling is not raised and the White House has to prioritize payments. Right now, cash-strapped states, which already depend on the feds. Are you surprised at this number? For 35% of their operating income. And that could be one of the first things to go if Washington, D.C. no longer has a blank check to hand out that money. What would the states do without this money, Liz Claman?
Well, look, all you have to do is look at California. California didn't get a federal bailout. They actually, imagine this, started to look at their balance sheet and figure it out. They started cutting funding. I'm not happy. I'm a Berkeley graduate. They cut to the UC system, more than $150 million for one university. But they try to figure out, how do we get more fiscally austere? That might not be the worst thing.
California which is where you are now, Lenore, actually went out and borrowed $5.5 billion from a hedge fund. Who in their right mind would loan cash to the state of California, which can't pay its basic operating expenses?
I agree with you, but it has the implied backing of the federal government. We've got the California getting $5.4 billion as a hedge against a sudden cut in government subsidies. You've got where New Mexico says it's got maybe 22 days where it can pay its bills. Pennsylvania says maybe a couple of weeks it can survive. All of this sounds vaguely familiar. For years we've been listening to our elected officials going crazy over this concept of too big to fail,
right,
whereby the large financial institutions, a couple of them having a few problems, was going to bring down the entire global banking sector. We'll talk about irony. While they've done all this public hand-wringing, they've created this massive web of dependency, all under the guise of solving your problems for you. And now cities, families, states are going to have to face their own financial problems without the backing of the federal government.
You have heard me, Ellis, complain about the culture of dependency, and in those conversations I'm talking about individuals dependent upon government. As the statistics point out, as Lenore articulated, as Liz lamented, the states are dependent upon the federal government as well. Where is that 35% going to come from?
Well,
the Fed's printing presses?
No, and the states don't have their own printing presses, unfortunately. But here's the problem with the United States. You're right about the culture of dependency. There's no denying that in all states.
But it's worse than we thought.
But it can't be that every single governor is an idiot, or that every single of the 50 state legislators don't know what they're doing. I mean, there are some structural problems here. There are decisions that we as Americans need to make. What do we want our government to provide to us? And it turns out there's a lot of stuff we want, and it's expensive.
We only have about 30 seconds left, Liz. Is it the idea that the good times would never end, that the Fed could always loan money, that the Chinese would always loan money, and we could always spend more than we earn?
Well, under both Republican and Democratic presidents, you've seen that debt ceiling raised more than 70 times since 1968 or something?
Never with this fuss.
Yeah, and so why not? Why wouldn't they believe that? This time around, there seems to be a real serious discourse about it and the potential for it.
First time that there's been this kind of a serious challenge in our lifetimes to the concept of raising the debt ceiling.
That is true. It's sad we didn't get a smarter conversation about it, though, honestly.
All right. Lenore Hawkins, Ellis Henican, Liz Claman, thank you very much for joining us. Back with why the federal government can no longer indulge in debt anymore. Ellis Henican is going to love this one, and it's next.
As we continue to